I'm going to contrast what it's like at another hospital where I don't use this versus the hospital where I do use this. So traditionally, just beginning the day, it ends up being chaotic. I'm not granted anything. Like tomorrow when I get to that hospital, I'm going to go get a paper census from the intake department. I'm not going to have any situational awareness. I don't know if those patients are actually in those rooms. I don't know who's severe. I have to coordinate with my nurse practitioners and my physician assistants to text them. I have to tell them who they're going to see, who I'm going to see. The day already starts off completely chaotic. So let me tell you a better way that we do it with Psynk AI. So first and foremost, I have my critical tasks that need to be done. So firstly, things like legal holds or pending discharge summaries. I have my list of things that need to be done, and I can quickly go through those and accomplish all of the important tasks for the day. And I have a live census. So what's great is this will link to any kind of EMR, Cerner, Epic, anything else that's out there. And it'll have a live dashboard. So if a patient loses rooms, this will be updated. Of course, I could sort by room number, admission date, etc. And very quickly, I can also assign my mid-loads. So if I have a nurse practitioner seeing some patients, if I have a PA seeing patients, I can quickly assign it. And my notes never get lost. I know exactly which notes are pending for the day, which ones are in progress, and which ones are completed. So I'm not having to think, what needs to get done. All in one place, I have this dashboard to get everything done. And what's really helpful is as soon as I come in, I have situational awareness. I have patients that are color-coded by severity. So we have patients that are red, yellow, and green. So the red patients are patients that have severe symptoms over the past 24 to 72 hours. Auditory hallucinations, suicidal thoughts, acting erratically. So again, when I come into the hospital, I have situational awareness of who needs to be seen, the patients I need to prioritize first. And sometimes at my old hospital, I don't even know what my patients look like when I come in on a Monday. Here I got pictures. And I know this maybe you can find it in a different place, but what's nice is everything is in one place, one dashboard. I have total awareness as soon as I enter the hospital.
Schedule a demo today to focus on what matters most with Psynk AI.